raise your right hand, Doctor. Do you swear the testimony you're about to give in this matter will be the truth, the whole truth, and nothing but the truth?
I do.
Good evening, Doctor. Could you please introduce yourself to the jury?
My name is Robert M. Shugarth.
And Dr. Shugarth, could you tell us a little bit about your occupation? What type of doctor are you?
I'm a orthopedic surgeon with subspecialization in spine.
All right. And if you don't mind, would you please, starting with college, tell us a little bit about how you became an orthopedic surgeon, some about your training and education.
I did my undergraduate training at Indiana University in Bloomington, and medical school was also done at Indiana University in Indianapolis. I then did my internship and orthopedic residency at the Mayo Clinic in Rochester, Minnesota, and that was until 1991, and then went to San Francisco and did a spine fellowship, and then returned to Indiana in 1993.
And how many years of training did you have to become, I assume you're a board certified orthopedic surgeon?
Yes.
How many years is that?
Including college, and
Yep.
14 years.
Okay. And can you tell us a little bit about the significance of a fellowship? I understand that not all orthopedic surgeons are fellowship trained.
Yeah, it's just extra, usually an extra year of training in a specific focus in orthopedics. Spine is one, obviously sports medicine, but for my specific interest, it was spine.
All right. Can you tell us a little bit about what type of medical practice that you have here in Indiana?
I'm in a multi-specialty group with 18 partners in all orthopedics and podiatry, and we each are subspecialized in a different field. Myself, again, as we discussed, is spine.
All right, thank you. Did you ever have an opportunity to treat a patient named Dannette Griffith?
Yes.
Can you tell us about when you first saw Ms. Griffith and what was the situation and you were seeing her for?
The initial time I saw her was back in actually 2000, actually 3/7 to 2000. At that time, she was seen for some neck and arm pain and was referred by Dr. Kramer.
Okay. And I take it that you saw her somewhat on an ongoing basis, like 5 or 6, maybe 10 times, and ultimately performed a surgery.
Yes, correct.
Can you tell us what was the nature of the surgery that you performed?
Because of the symptoms she was initially seen for, on 3/20 of 2000, she underwent a anterior cervical decompression infusion, which is basically removing 2 of the discs in the neck that had become problematic and painful and were causing symptoms, and then fusing those 2 together.
And when you say fusing those 2 together, is that like using pieces of metal and screws and attaching 2 bones together, or 3 bones? How many bones are?
In her situation, it would be actually 3, because there were 2 discs that were bad, and the disc is removed, and usually a piece of bone, a donated bone, or actually hip bone from the patient is placed, and then you're correct, a titanium plate is put in to hold everything in place until it heals.
Okay. How did she do after that surgery?
She did well after that surgery. Let's see when I last saw her for that. Her last visit with me was in May of 2001, and at that time her x-rays looked good, and she was having a little bit of neck pain at times and some headaches, but for the most part the pre-op symptoms had resolved.
All right, good. Dr. Shugarth, can you tell us what memory you have of how she presented back in May of 2001 on the last visit? Was she, able to walk easily, communicate, do things, do a job?
Yeah, based on the record that I looked through, yes, she was working and was able to do most of the activities, and I don't recall any specific restrictions we had on her at that time.
That was my next question. Any restrictions?
No.
Okay, good. Doctor, when was the next time after that you saw Ms. Griffith?
The next visit was June 4th of 2013.
All right. Can you tell us what your understanding of the reason she came back to see you?
Yes, the complaint at that time was neck pain and low back pain, and she had said that she had been involved in an accident in 2007 that had increased symptoms through her neck, shoulders, and back.
Okay. What did you do after that first visit? What was your plan as far as how you could help her?
At that time, she did have some MRIs, and those were reviewed. And I think what we had were just the reports, and we wanted to evaluate the complete set of x-rays just to see what was occurring above her previous fusion.
And were you able to do that?
Yes.
How did she look? What did you think was going on with her physically?
At that time, she was having predominantly neck pain, and her reflexes are intact motor-wise, but she was having mostly neck and upper extremity and kind of shoulder pain.
I noticed in one of your records there was a reflex of 0/0.
Yes.
What does that mean?
Usually there are different grading systems. 0 is kind of normal, -1, -2 is decreased, and then +1, +2 is an increase in reflexes.
All right. Let me ask you this. Now, when you saw her in 2013, what was the presentation like? How did she appear differently to you, if any?
Compared to the last notes, and then when I saw her in 2013, her symptoms in the neck and shoulders had increased.
Okay. Did she seem to relate to you that it was caused from the motor vehicle crash?
Yes.
Did she indicate that she was working full-time for Terminax, doing inspections of homes and stuff before the motor vehicle crash of 2007?
Yes.
Okay. Do you feel that she had certain pre-existing conditions due to the injury she had from the 1999 car accident and your treatment in 2000? Did these pre-existing conditions exist in her body before the 2007 motor vehicle collision?
With respect to the surgery that she underwent?
With you, yeah.
Yeah, none specific. I mean, once those levels have healed and fused, there's really no issue there. It would be at an adjacent level or somewhere else that she could potentially develop problems.
Based upon your seeing her before and then seeing her after the 2007 crash, do you feel that the motor vehicle crash has aggravated or caused any additional problems for Ms. Griffith?
Based on the history, yes, that's when she said things worsened.
Okay. And is your opinion within a reasonable degree of medical certainty that the motor vehicle collision aggravated the pre-existing conditions?
Yeah, again, based on what she told us and what we identified, yes.
And doctor, do you have an opinion as to whether the condition that she now suffers from as she relates to the motor vehicle collision are permanent in nature? In other words, under Florida law, they're going to cause her symptoms or problems for the rest of her life?
Assuming that the accident was in '07 and obviously we're in 2014, over that period of time, I would state that that would be something that would continue on, yes.
Okay. And is that opinion within a reasonable degree of medical certainty?
Yes.
Okay. Do you think that the conditions that she's now suffering from cause her to not be able to work?
It could. I don't recall her having any type of an FCE or any specific testing to that.
Okay.
But what she said, she was unable to work at this time.
All right. Doctor, are you familiar with a medical condition called cervical dystonia or spasmodic torticollis?
Yes.
Is that the type of condition or that's caused by physical trauma?
Yes, it can be. Correct.
Okay. And what is one of the more common treatments for that condition?
It's usually physical therapy. Sometimes we'll do trigger points. And some of the physiatrists up here will even do Botox and things like that to try to help resolve that.
Okay. Do you know whether you thought she had cervical dystonia or spasmodic torticollis when you saw her?
No, not at that time.
Okay. Doctor, I'm going to kind of ask you a hypothetical question, and that is assuming that Ms. Griffith's health was really pretty good before the 2007 motor vehicle crash, and then we saw the decline. Would it be your opinion that the incident, which would be the 2007 collision, directly and in a natural and continuous sequence produced or contributes substantially to producing the injuries that you said are permanent?
Yes.
Can it be reasonably said that but for the 2007 incident, the permanent injuries would not have occurred?
Yes.
Can you explain to the jury what you perceive would be the restrictions on Ms. Griffith's activities of daily living now?
It would be hard to assess just from seeing her on those 2 visits. Normally what we would do is probably assess her in a FCE type of situation in physical therapy to get some objective data as far as activity level.
Did you notice if she was able to, if she had an antalgic gait?
I do not recall.
Okay. And I might ask you to reflect or look at your records.
Oh, I'm sorry, she did walk with a cane, so was having some gait abnormalities. Correct.
And doctor, I'm going to ask you if you've heard the analogy, a chain is only as strong as its weakest link.
Yes.
Do you think that that would be an appropriate analogy for Mrs. Griffith, considering the prior surgery she had in her neck and then being involved in another motor vehicle collision?
Yes, we do know that if somebody has a fusion, they are at risk for some adjacent level issues, so it probably does predispose people to that.
Thank you very much, doctor. That's all the questions I have.
Good afternoon.
Microphone, please.
Sorry?
Yeah.
So, doctor, you first saw Dannette Griffith back in the year 2000, correct?
Yes.
And that was due to her being involved in an incident in which she was struck by a car.
Yes.
Do you recall that?
Yes.
All right. And then you hadn't seen her since she recovered from her surgery back in 2001, correct?
Correct.
And at that time, she was complaining of bilateral numbness in her upper extremities, correct?
Correct.
Right. And so then she came back to you in the year 2013, and you examined her once, correct?
Correct.
All right. Now, you also got reports of MRIs,
Yes.
and those MRIs, in your opinion, showed you what objectively?
She had some disc bulges.
Okay. Was there anything from the MRIs, and you later saw the MRIs yourself, right?
Correct. They were set.
And were there any findings in those MRIs that showed that she had any trauma to the area?
No, none specific.
Okay. Now, when she came in and saw you in 2013, was she wearing a collar?
No.
Okay. And she came back a second time after the first visit, correct?
Yes.
And she, at that time, underwent another evaluation by yourself
Yes.
and by another doctor.
Yes.
And she underwent what's called EMG.
Yes.
And what is that?
An EMG is a test that evaluates for nerve damage, or what we call radiculopathy. If there are pinched nerves in the neck, it can evaluate acute findings and chronic findings, and it helps us determine potential levels that need to be treated.
Okay. And that was of the upper extremities?
Yes.
And what, for the jury's benefit, what are upper extremities?
Arms.
Okay. And what was the result of the EMG study?
It was normal.
Right. So there was nothing to show objectively from the EMG that there was any radicular symptoms going on with Ms. Griffith.
Correct.
When you visit with a patient, you take their histories, correct?
Yes.
And a history is essential for you in diagnosing why they're complaining of what they have, correct?
Correct.
Now, when she came and saw you this second time and had the EMG, you already knew that she was involved in this accident that we're here for today, correct?
Correct.
All right. And so the second visit with the EMG was to determine whether surgical intervention would be necessary?
Correct.
And you determined that surgical intervention is not necessary, correct?
Yes.
All right. And you also determined that you just said that you didn't find that she had any diagnoses of cervical dystonia, correct?
Correct.
Now, when you see Miss Griffith 13 years after you last treated her, you're relying on the history that she gives you in rendering the opinions that you just gave.
Yes.
All right. So she told you about this incident that we're here for, the auto accident involving my client, Dr. Baptiste, which occurred June the 6th, 2007.
Correct.
All right. Did she give you any other history of being involved in any other accidents after she left your treatment?
No.
So she didn't tell you about any other accidents which she was involved in, which could have caused her injury?
No, she did not.
All right. So I want you to assume that she was involved in several accidents after the accident we're here for today, okay? And I want you to assume that she was involved in a rear-end auto accident in December of 2002 in which she was injured. She was involved in a September 27th, 2004 auto accident in which she was injured. She was involved in a 2005 slip and fall incident in which she was injured. And she was also involved in a minor accident in June of 2004 where she just hurt her thumb. No big deal. Now, she was treated with many doctors from the point in time from 2002 up until the point in time of our auto accident. Now, I want you to, with those assumptions known, do you still believe that the auto accident of June the 6th, 2007 is the cause of the permanent aggravation of her pre-existing symptoms that she had due to the accident that you treated her for?
Yeah, with that history and multiple episodes, it could be potentially any one of those or many of those that, yes, caused her symptoms.
So you're not able, within a reasonable degree of medical probability, to say that the June the 6th, 2007 auto accident caused a permanent aggravation of her pre-existing conditions, correct?
Yes.
Thank you.
Dr. Shugarth, let me ask you this. If I were to tell you hypothetically that after the rear-end car accident of 2002, Ms. Griffith was able to return to work, do all her activities, had no restrictions whatsoever, would that then again support your opinion that the June 6, 2007 crash was the aggravating precipitation of the condition she has now?
Yes, or that one did not have any issue. You're correct.
And if I were to tell you that the September 27th motor vehicle accident in 2004, afterwards she had a little bit of treatment and then was able to return to all her normal activities of work and home, would that then support your opinion that the June 6, 2007 was the cause of the condition she has now?
Yes.
Okay. And if I were to tell you that the slip and fall in 2005, after care and treatment, she returned back to full-time work and was able to resume all her normal activities without any lingering problems, would that, again, support your opinion that the condition she suffers from now is from the June 6, 2007 motor vehicle crash?
Yes.
Okay. And obviously the 2004 thumb had nothing to do with it.
Yes, correct.
Okay. Based upon me giving you those answers, do you still maintain the opinion that she has a permanent injury, which was the aggravation of her pre-existing conditions?
Yes, based on the history.
And doctor, if in fact she had some residual problem from 2002 or 2004 or 2005, would it be your opinion that those residual conditions could have been or were aggravated by the 2007 motor vehicle crash?
Yes.
Okay. And doctor, you don't necessarily use an MRI as a test for trauma, do you?
We do, but it's not, doesn't always show myofascial injury and other things. It's really used to look for fracture and disc herniation and things like that.
Right. And typically when you're looking for trauma with an MRI, you would do it within minutes, days, or hours of the traumatic event. You're not necessarily trying to look 7 years later back in time with an MRI, are you?
Correct.
Okay. The fact that Ms. Griffith had a normal EMG, that doesn't change any of your opinions about the injuries that she continues to suffer from, does it?
No, it really just rules out a radiculopathy that could potentially be treated.
Okay, all right. Thank you very much, Dr. Shugarth. That's all the questions we have.
Yeah,
I completely object because it's
It-
direct, cross, and redirect.
okay, it's within what you were just asking him, so we can try to truncate this and let the judge rule afterwards.
All right, you give me a standing objection.
Okay, sure.
Good.
All right. Doctor, your opinions are based solely on what Ms. Griffith has related to you through the records and what's just been presented to you in the hypotheticals, correct?
Correct.
So the opinions are based on what Ms. Griffith says, and you're taking those into account, correct?
Correct.
Now, your last visit, you a diffuse nature of pain,
Object to the form of the question.
correct?
Yes.
Beyond the scope of cross or redirect.
And was that diffuse nature of pain, was that anything to do with the findings objectively that you noted?
Object to the form.
Yes, correct.
Okay. Now, the cervical disc bulge and the back pain, do you believe that was a result of the June the 6th, 2007 motor vehicle accident?
Object to the form.
Or could it be due to the other accidents that we just related to you as well?
Object to the form.
Could be potentially either one, yes.
All right. Thank you.
Doctor, defense counsel suggested that the only thing you had was Mrs. Griffith's word. But in fact, you had a greater detailed history because you knew her before, correct?
Yes,
And you also had the opportunity to examine her years ago,
correct.
and you had an opportunity to examine her every time she came back here in 2013.
Yes.
So to say that you relied purely upon what she said would not be an accurate statement.
No, we rely on her history and then any of the tests that we had, MRIs and EMGs.
And if there's a suggestion that the disc bulge was from something previous, would you agree that that would be aggravated by a motor vehicle crash in 2007?
Yes.
Thank you very much, Doctor.